So today I'm going to talk about continue my journey with my mitral valve issues. Um, as you might recall from a previous video, I talked about the fact that I had mitral valve insufficiency and I had a transesophageal echo to look at the mitral valve. And so I had a visit with the heart surgeon. So I just wanted to let you know how this progressed. Just everybody knows that we physicians, even though, we try our best, obviously, I'm on no medication whatsoever, no blood pressure medicine, never smoked, exercise regularly, but you can still get into some issues with your circulation, and we're humans too. So I thought I'd update you on my condition here. As you might remember, I had a transthoracic echo where they put jelly on your heart, on your chest, and take a look at your heart. And I've had that for several years now. This whole business started about 4 years ago. Actually, probably about 6 years ago is when I first started having problems. But like a typical male, I blew it off. So about 6 years ago, I woke up one day and I was in atrial fibrillation, which is an irregular heart rhythm. I knew it. It lasted about 3 minutes, and I was like, I'm over it. I'll be fine. So I never followed up on it, and that's probably when I started having mitral valve problems. I had palpitations on and off once in a while, but really nothing severe. And then I went to see my primary doctor about 4 years ago for my checkup, and on his examination, he said, you got a heart murmur. And I was like, I've never had heart murmur in my life. And he looked back at his records, and I didn't. So anyway, that led to a cascading series of events. I had a buddy of mine, cardiologist, who did an echo of my heart. That's again where they put jelly on your chest, take a look, and you look at your heart valve function, heart function. And the echo showed I had very mild aortic regurgitation, which really is not relevant whatsoever. But my mitral valve did have regurgitation. Remember, the mitral valve is the valve in between the left side of the atrium and the left ventricle. The left side of the heart is what pumps the flow back out towards your heart, the oxygenated blood. So this mitral valve sits between the top chamber and the bottom chamber, and its job is when your left ventricle contracts to push the blood out, this thing is supposed to close and prevent blood from coming back up again into the top part of the heart, but rather go out through the aortic valve to supply your body with oxygenated blood. Well, mine is leaking all of a sudden. And so my initial echo showed I had mild to moderate mitral regurgitation, again, no symptoms. And then I had an annual echo, and my last echo was in December of 2022, and looked pretty much the same, mild to moderate mitral regurgitation, and I had some mild aortic regurgitation, which again was unchanged. My heart function, my what they call ejection fraction, how well that muscle pumps out blood, looks good. The size of my heart was not bigger. The chambers of my heart were the same size, so really nothing had changed. But just out of abundance of precaution, my cardiologist talked to a heart valve surgeon. They're really specialized, some of these guys. And so talked to heart valve surgeon. She's really good. She's in Dallas here. And hope I didn't identify her, but anyway, she requested that we get the transesophageal echo, which I did, as I related to you. And the results showed that I had kind of severe mitral regurgitation. I also had a CT of my heart and my aorta and all that stuff. Everything else looks great. My aorta looks fantastic. My coronary vessels look great. No blockages, but I've got this significant mitral regurgitation. So the reason for it is that the mitral valve is tethered into the ventricle by this cord. It's called a chordae tendineae, and this obviously mine had torn on one of these chordae had torn, and I have regurgitation because as soon as my left side of my heart contracts to pump the blood out to the rest of my body, the force of that blood going up, because of the ruptured cord, causes the mitral valve to flip up and blood goes back up into the atrium where it shouldn't be going. It should be going to the rest of my heart. I mean, it's the rest of my body. But it flips up into the atrium a little bit. And so mine is considered moderate to severe, I guess. I don't really have any symptoms at rest with it. I'm not short of breath. Anyway, I went to see the heart surgeon to kind of get an opinion on it, and it's really an interesting meeting. Got a lot out of it. She's fabulous, really nice, great reputation, and we talked about symptoms and stuff. She asked me questions which I never even thought about, honestly. She said, "Well, are you more fatigued lately?" And I'm like, "Well, I'm 62 years old. I think I'm getting fatigued at this point in my life." I mean, I burnt the candle at both ends all throughout my career. When I was younger, there was a period where I didn't take a day off for 6 months. I mean, I worked day and night for 6 months, and so I kind of overdid it when I was younger. So I thought, okay, well, that's part of it. But also, I'm 62 years old. I mean, how much can you put a body through? I overdid it pretty much everything, in deadlifting and all this stuff that you never think as a young person is going to damage you. It damaged me. But anyway, short of breath, no. I quit running 2-3 years ago because my knees hurt me. And I'll kind of talk about that also, because that made a difference to my lifestyle. So I quit running 3 years ago because my knees were hurting me, and my orthopedist told me, if you keep going, you're gonna have knee replacement. I was like, no thanks. So, but in terms of like shortness of breath, never at rest. Before I got plantar fasciitis, I was walking 5 to 10 miles a day, no problem, no shortness of breath. So I have noticed, however, that if I exert myself quickly, like if I walk up 5 flights of stairs, I get short of breath. I'm thinking, well, maybe that's just because I'm out of shape. But maybe it actually is the mitral valve. And I've also told my wife, I'm kind of tired lately, which I never would have said before. So maybe I am a little bit symptomatic from the mitral valve. I don't really know. I don't feel bad. The quality of my life is not like it was about 10 years ago, but still, don't feel bad at all. So she talked about repairing my mitral valve to prevent things from getting worse. What does that mean? That means, getting my heart working harder and harder to do its work because it's inefficient. Part of the blood flow is going back up through the mitral valve into the atrium rather than going out through the aortic valve into the body. So you get into situations where I get congestive heart failure eventually, or enlarged atrium go into regular rhythms and more often, all that stuff. I will say this, that part of the thinking, in my mind, back in my mind was, my mom unfortunately passed away about 4 or 5 weeks ago from intractable congestive heart failure from multivalvular disease. So maybe this runs in my family and I'm starting to get some of this stuff. So that is in the back of my mind. It was not it wasn't a pleasant thing to watch my mom, who's a very active woman, go through the time period where she could not be active. She got incredibly shortness of breath with minimal exertion, and she fell, broke her pelvis, and I'll spend some time on that one. Older people, when they fall and break something, their prognosis really plummets. So, that's something that we need to discuss somewhere down the line. But nevertheless, I'm thinking to myself, maybe I should do something preventative, even though I don't feel too bad. So, having said that, we continue our discussion about, timing the surgery. What are the risks? The surgery, 1% risk, less than 1% risk of dying or stroke from the surgery. Thank you very much. Or, what's the potential downside of not doing anything? Am I going to go into eventual congestive heart failure that won't respond well to surgical treatment if I need it at a later date? All these issues came up. So I just have to think about things and make a decision, even though I don't feel too bad, whether I want to go through this or not. I will say a funny thing. It's not really funny, but it struck me as odd. I said, I got a lot of things going on. What happens if, can I wait like about 6 months or a year? Because we're starting a vascular training program and I got a lot of things going on. Can I wait? She said, yeah, that's fine, but you have a slightly increased risk for sudden death. Sudden death. Well, I guess it isn't a slow and inexorably painful death, so at least I got that going for me. But it reminded me of that old David Letterman skit, that skit that they had where they had those stupid pet tricks. That Bailey the dog that was on. That one cracked me up. Bailey the dog. They would ask the dog. The handler brought the dog on, and he would say to Bailey, "Bailey, play dead." The dog would go. I don't know why I thought of that. I'm thinking, sudden death doesn't sound too good. So maybe it's pushing me towards getting the procedure done. I don't know. I'm gonna think about things and make a decision, hopefully informed. But the reason I tell you this stuff is, everybody faces these things. Be informed about the decision making that you have. What are the risk benefits of anything you go through? It doesn't mean that if you go through a procedure, you're going to necessarily come out the other side just perfectly fine, but at least you have an idea of what you're getting into, rather than just taking it at face value. Especially decisions like this that are critical, and have some potential downsides to them that are significant. Anyway, we'll talk about it later.